Having my blood drawn at the Gift of Life Transplant House is really a benefit. It saves so much time and energy, not just because some mornings I'm just sick, for lack of a better word, and I can't imagine what it'd be like if every morning I had to get dressed, go to the clinics downtown or to the hospital, and do that on an empty stomach and wait in line for long periods in a weakened condition. It would be a trial on me. It's very convenient being in the house. I can run upstairs, get the blood drawn, and then get something to eat if I need it, or go back to bed if I'm feeling ill and tired. It's so convenient. I'm really thankful that you have this program. It's a necessity to have this. It's not just a convenience or a privilege. It is a necessity. It is very good to the healing process and overall feeling of patient attitude.
Transplant house, I think 89 days now, and every day for a long time. Now I've got it down to once a week, and if it coincides with my appointments at the hospital, I always go there. Like this morning, I went to the blood draw at 8:15, and my next appointment is at 12:45. You don't have to make a trip down to the hospital, and then when you don't have an appointment right away, you'd have to come back and then go back again. So it's I'm not taking up any beds or any space, at the hospital. I think it's benefit for the hospital, and benefits us.
I've been here since the 12th. My wife gave me her kidney, and it was our anniversary. The blood draw program works very well for me, but it even works better for my caregiver, who doesn't have to come over and get out of bed if they don't want to, and you get your blood draw, because usually your appointments are later to see the doctor afterwards, so it just saves a lot of time and makes it more convenient for everybody. Let's say you had to go over to the clinic and do your blood draw. It'd be at 7 o'clock. Well, let's say your appointment is until 10:30, what do you do, This way you can go back to the room and take your medicine and take your blood pressure and get something to eat, and caregiver can get ready to take you over to your appointments, and it's just more leisurely.
We were having to go in. They do morning draws at about 7 at the hospital, so you have to get up really early, catch the shuttle, be there, and then you may not have any other appointments that day. And everybody at the hospital got to know who you were. That was really nice. But also here, it was nice not to have to sit among 200 people waiting to get up and get your draw done. The scheduling worked really well. Once you're checked in and get your draw at the hospital, it takes you about an hour and a half to get ready and get out the door and go, especially since I'm kind of weak and in the wheelchair and all that, because they had to load me on the wheelchair bus, the shuttle, and then we'd have to wait for a shuttle from the hospital to come back with the wheelchair, and usually they can only carry one wheelchair, so it just added a lot of extra time, and I'm still kind of puny, so it just took more out of me. And when I could stay at the house, I could do more like physical therapy and things like that. If I went and did all that, it made me so tired when I got home I'd have to lay down and take a nap, and this way I could just get up and proceed with my day. It's nice to just be at home.
This project to me is so cool because it's Mayo at its best. It's collaboration, it's partnership, it's surrounding a wonderful goal, enhancing our patient experience. It's so pure. We're serving our patients. We're serving our patients in a unique way. We're showing that we can work differently. We're showing teamwork, that we can transform the practice one action at a time, and I think that's our core principle, and we're lucky to have a wonderful partner in the Gift of Life House as well.